Uterine fibroids are benign tumors that grow inside the uterus, and they typically affect women in the reproductive age.
We see them in patients as young as their late 20s to early 30s up to their mid to late 50s. A lot of patients end up with uterine fibroids. We're talking about upwards of 40 to 50% of females end up with uterine fibroids. The ones that do have symptoms report to us heavy menstrual bleeding, pelvic discomfort, pelvic pressure, urinary urgency, in addition to constipation.
Fibroids, while they are benign, non-cancerous tumors, they do affect your quality of life. So for women that suffer with fibroids, it's debilitating to the point where they cannot function at their jobs and have to take days off. Just being a mother and doing their normal activities and taking their kids out to school or doing chores can be affected by the amount of pain and bleeding that they suffer from.
Treatment options for patients with symptomatic uterine fibroids would be either to medically manage it or surgically. The surgical treatment tends to be pretty extensive, surgery with a longer recovery time. Surgical options would be to either shave off the fibroid that's causing the symptom or actually going in and removing the whole uterus with the fibroids.
Hysterectomy requires a large incision and requires a longer recovery time, and there can be more post-operative complications and pain. Versus a fibroid embolization, it's all done here in the office. It's an outpatient procedure. You go home the same day. There's less pain, quicker recovery time, and you get to keep your uterus, which is a huge thing for a lot of women.
You're not going into the hospital to get a procedure done like this. That's very important, especially when, patients are looking at their medical bills and they're looking at their deductibles, and just having this high quality option for you as an outpatient I think is very key.
So UFE stands for Uterine Fibroid Embolization, and what the procedure does is cut off the blood flow to the fibroids.
It starts with a consultation. We see the patient, we evaluate them, we make sure that they are a good candidate. Once we do that, and we get an MRI to make sure that this is what we're dealing with. And then after that, we schedule the patient for the procedure. Patients show up in the morning. They are greeted by the nurse and by our interventional team. The procedure itself, minimally invasive, means that there is no major cutting, means that it is an outpatient procedure done here in clinic. It takes about 45 minutes to an hour on our x-ray table. Patients are comfortable, they're sleeping, they're sedated. We start an IV and everything's done through an IV. We use tiny little tubings called catheters that we guide under x-ray guidance, and we find our way into the arteries, which are the vessels that are feeding those fibroids and the uterus with blood supply. And what we're doing is we're cutting off that blood supply.
So the recovery time is a lot better than a hysterectomy. It's recovery time of 2 hours after the procedure is finished here at Viva, and then you go home that same day. Now, women will report some pain and cramping after the procedure is finished for some period of time, but after about a week or so, you're back to your normal activities and you can do everything you wanted to do beforehand. UFE can improve someone's life greatly. The symptoms of fatigue due to heavy bleeding go away. The pain that you'd suffer from because of the fibroids and the cramping, they go away. The ability to be able to pee normally again comes back. So a lot of things that you thought were just part of your lot in life no longer have to be the case, because fibroid embolization can treat those symptoms and give you that life back again.
It is a highly effective procedure. We're talking about 80 to 85% improvement in symptoms of heavy menstrual bleeding and about 75 to 80% improvement in the bulk-like symptoms.
Ladies, if you suffer from fibroid disease, you have a treatment option for you, and it's called fibroid embolization. Just give us a call at Viva and we'll be happy to see you.